being a Sierra Leonean living in Glasgow, and obviously, like everybody else, are concerned about this Ebola outbreak. So I can see Dr. Emma Thomson, who is official title Clinical Senior Lecturer at the Center of Virus Research at the Medical Research Centre, University of Glasgow in Scotland. Make we go possibility here for say about Ebola. Dr. Thomson, what is the Ebola virus?
So Ebola virus is one of a group of viruses which cause a syndrome called viral hemorrhagic fever. There are 5 types of Ebola virus. The one which is causing major problems in West Africa and in Sierra Leone at the moment is Zaire Ebola virus, which unfortunately is the one which has been associated with high mortality rates and very, very serious illness. The illness itself caused by Ebola virus is characterized by very high fever. So fever is the main presenting symptom for most patients. Otherwise the symptoms can be very non-specific and very difficult to disentangle from other common illnesses like malaria in particular. Other common symptoms include sore throat, diarrhea, and diarrhea has been a common symptom in this particular outbreak, muscle aching, always with fever, and in the later stages you can get bleeding, although bleeding is not a common early symptom of Ebola virus infection.
Okay. How does the virus survive and spread?
So Ebola virus survives inside infected individuals and inside the reservoir host, which at present is thought to be the fruit bat. And so it first gets into humans, probably through contact with fruit bats, and then is spread from person to person through direct contact, usually with bodily fluids. So those bodily fluids would include blood, sweat, diarrhea, fluid like that. And to get infected you need to come into direct contact with that fluid or with a surface which has been contaminated with that fluid. So people are getting infected through contact with relatives or loved ones who have the illness, through direct contact, or through burying their loved ones and getting into contact with the body of those people. And people are also getting infected through contact with things like bed linen, which has become soiled with fluids.
Right. Okay.
The good news about Ebola, if there is any, is that it is actually possible to stop transmission by taking a lot of care about not coming into contact with body fluids, and that applies to people in the general population and in particular to healthcare workers who are very likely to be looking after people who may be vomiting, could even be bleeding, and but for those people they can keep safe also as long as they very, very strictly look after, take care, and that means using gloves and etc. There are very particular ways in which healthcare workers can prevent themselves from becoming infected.
Okay. Are there ways that individuals can reduce the risk of contracting the virus, which is, I think, what you were
yes,
touching
so
on there?
this is critically important, and this is the way in which the outbreak can be stopped. So people need to avoid contact with someone who is having a high fever, who is displaying symptoms of Ebola virus infection, And so keeping a distance from someone who is very unwell in this way is very important. Getting someone into hospital is important, and my understanding is that in some cases this has been a difficult thing for relatives, because it means that this may be the last time they see their relative again. Unfortunately, that is true, but there is a much higher chance of survival if your relative is in hospital, and a much lower chance of other people becoming infected with the virus. Now, we'll probably come on to why people die of Ebola virus, but actually one of the most common things is that they become very dehydrated. Not that they necessarily hemorrhage to death or bleed to death, which is what people worry a lot about. Dehydration is probably the main reason that people die, and in hospital you can have intravenous fluid, and that's a very important treatment measure.
Right, okay.
Now, other ways, other things that are very important are hand washing. So soap and water will kill the virus. Alcohol-based hand rubs will kill the virus. And using bleach substances and so on for washing sheets and things which have been in contact with fluids is a very good way of killing the virus also.
Patients who recover from Ebola are given the all clear. How should they expect to be welcomed back into their communities?
Yes, so patients who have recovered from Ebola virus should be welcomed back with open arms. They will not be released unless they're considered to have recovered from the infection, and there is almost no risk of them passing on infection. I would say no risk, except that there is a very tiny chance of sexual transmission of Ebola after someone has completely recovered. But there is no risk of direct contact causing problems. We would recommend that someone who has recovered from Ebola should avoid sexual contact for 2 months after recovery. But that doesn't mean that people who have recovered from Ebola should not be able to do all normal things. They should be able to have direct contact with anyone in the community, go and get their shopping, go and do normal things, and so people should not be shunned if they've had Ebola virus, and there are many survivors of Ebola virus, which is a good thing, and those people are not going to pass on infection.
Globally, how far has this virus spread?
So Ebola virus was first identified in 1976 in DRC, which was then Zaire, and has occurred many times in small outbreaks in Central Africa, in DRC, in Uganda, in Sudan, but has never previously reached West Africa. This is now the largest Ebola virus outbreak that we have ever seen, and unfortunately the number of cases in this current outbreak probably exceed the number of cases in all the other outbreaks put together. It's of a very significant concern at the moment, because not only has it affected small rural communities, but it has spread into urban areas, into the cities, and so the risk for onward transmission, unfortunately, is high. But I would like to emphasise, though, that it's also preventable. So if people are careful about hand washing, about not coming into contact with infected people, or people who've had the infection who have died, those are very, very important things.
Now, could you give us 2 facts about the Ebola threat and 2 myths about the Ebola threat?
Sure. So, well, facts about the Ebola threat. This is a very real threat, particularly for countries in West Africa at the moment, for countries bordering the areas which have been affected, and for countries which are within reach of international flights. Now, there is the chance that Ebola virus could be exported on international flights. In almost certainly in people who are in the incubation period of infection, so not symptomatic. In coming on to kind of myths, this virus is not transmitted through aerosol, so you cannot get infected by breathing in the air, by sitting next to someone who may have it. You also can't get infected from someone who is not displaying any symptoms. So you would expect that someone with active and infectious Ebola virus would be feverish and would be quite unwell. The effect of that actually is that people who are actively infected are a lot less likely to step onto an international flight, particularly a long flight, because if they were actively unwell, they probably would feel too unwell to get on a flight, but certainly there remains a risk. There have been a lot of other healthcare related myths, so I understand that in Nigeria, for example, people have been drinking salt water to treat the infection, and unfortunately that appears to have resulted in deaths. So I think it's very important to stick to what we know, and we know that prevention of transmission is critically important. Hand washing, keeping out of contact with infected people, those are incredibly important. If you are unwell, seeking medical assistance is important, both for yourself, because you will receive fluid intravenously, or with proper oral fluid treatments like oral rehydration salts is a good thing. But trying to take other types of medicine for which there is no evidence yet is not a good idea. And things like drinking salt or eating mangoes and that sort of thing, unfortunately, is very unlikely to have any effect on the infection.
Okay. The Ebola trial serum, ZMapp,
yes,
has been approved by the WHO for treatment of infected patients. As it's only been trialled on 2 previous people, what are your thoughts?
So my first thought about new treatments for this awful infection is that we must develop them, and that is very important. And ZMapp is one of the treatments that has promise, but has not been proved to be effective yet. Now, what we know is incredibly effective is to be rehydrated and to have supportive treatment in hospital. So we know that that's effective. ZMapp is an antibody treatment, is a monoclonal antibody treatment which targets the outer surface of the virus, and theoretically may stop the virus replicating or dividing, but as you say, has only been tested in 2 people. Now, in order to progress medicine, we do need to trial new medicines in people. They're always the first 2 people, and then the first 200 people, and so on. But there is very strict regulation and guidance about how that should be done. In this situation, the treatment was given to 2 people, one a doctor and one a nurse, who were able to give very clear, informed consent to taking a treatment which had never been used in humans before. It had been tested in non-human primates, but not in humans. And so in this case they were able to give consent. I think what's very critical about new treatments and new medicines is that patients who receive them should be able to give consent and say, yes, I'd like to try this new treatment, particularly knowing that when you have been infected with Ebola virus, there unfortunately is quite a high chance that you may not survive the infection. And it is usually best to do these sort of what are called treatment trials with a group of people who do not receive the treatment and a group of people who do receive the treatment. Now, I think that it's likely that we will see increasing numbers of people getting access to this treatment, and we will learn more as time goes on by looking at the group that had it and the group that didn't have it to see if
placebo group,
yes, the placebo group who don't get the treatment versus the people who do get the antibody treatment. We know that there is some evidence that giving serum from someone who has recovered from Ebola virus to someone who has it can be helpful, but that comes from very small numbers of people. But the most likely reason that serum transferred from someone recovering from Ebola to someone who's ill with it, making them better, the most likely mechanism is that antibodies are present and that they are neutralizing the virus. ZMapp is a combination of antibodies which may neutralize the virus, but we have to wait to see how well people do who have had that treatment. As far as I'm aware, the two patients who have received it well, two of the patients who have received it are doing very well. However, we need to look at far larger numbers before we know.
How long do you see things getting back to normal in Sierra Leone from a post-containment point of view?
Well, unfortunately, a disease like this, which has affected very many people in the prime of their lives and has caused major problems in society in general and in the healthcare system, is likely to have fairly far-reaching consequences. I think once the infection has been contained, and I think it can be contained, it will need a very, very concerted effort to make sure that infection control practices are followed, both from people in the community washing their hands and so on, and in healthcare workers who are under a lot of pressure to look after many patients, some of whom are very unwell. So that has to happen first, but after that has happened, and I think it can happen, with these what sound like quite simple measures, but they need to be very, very strictly stuck to, and that's the difficulty. I think Sierra Leone can recover from this and learn from this, and the whole world will learn from this. I hope that we will learn that outbreaks like this need to be contained rapidly, that unfortunately, if there are further outbreaks, which once the virus is present in the environment and in bats and so on, it may come back again. And what we have to learn from that is how to stop it developing into such a major crisis by isolation, by using quarantining methods and asking people who've been in contact with other infected people to take their temperature regularly, to keep themselves isolated, and for healthcare workers to be provided with the right equipment to prevent them getting infected while they are looking after members of the community in general. I think one of the critical things is that healthcare workers need support from the community. They're national heroes taking care of people in very difficult circumstances, and I think so supporting the healthcare service is very important in order to prevent future problems like this. But I think that it will be possible to contain this outbreak. I think it will happen. It may take some time, unfortunately. And I think then contingency plans for, if this comes back again, for how to prevent infection happening again is going to be really important.
Okay. Finally, there seems to be a belief and fear spreading in communities in Sierra Leone that Ebola can be spread through mosquito bites. Mm-hmm. Is this possible?
So there is no evidence that Ebola can spread through mosquito bites. Mosquitoes, female mosquitoes that bite people, they take up a little bit of blood, and so theoretically you might think that perhaps that could then be injected into the next person. There have been no reported cases of mosquito-borne transmission, though, of this virus. Of course, mosquitoes can transmit other diseases, particularly malaria, and other diseases like chikungunya infection and dengue, but there is no evidence that mosquitoes transmit Ebola virus.
Thank you.
Okay.
Thank you very much.
Okay.
Okay, so I asked Dr. Thomson 9 questions about Ebola. The first one, na wetin na Ebola. Dr. Thomson will get this for say. Ebola na a group of virus there where they cause a syndrome called viral hemorrhagic fever. 5 types of Ebola there. The major one where they affect we na the Zaire Ebola virus. Now, Dr. Thomson also comments, he say, illnesses that were caused by Ebola, a fever similar to malaria, sore throat, rumbelle, and later stages, na they see bleeding. Number 2 question we asked Dr. Thomson, how the virus they spread and survive? Dr. Thomson say, it is survive inside mortal man and other host them, such as this fruit bat, it is spread from person to person through body fluids such as blood, sweat, sperm, rumbelle, and also direct contact when you dey bury somebody we don't die from Ebola. So now for take time, obviously, how you dey handle the body. Further point, with the book, then you bed linen, then cover close, then self-kin soiled with fluids there. So that safe na other way for make the virus spread. It's possible for stop transmission of Ebola. Try not to get in touch with them bodily fluids there. The third question was asked Dr. Thomson, how for reduce the risk? He say, avoid person where they show signs of Ebola. Make the person go to treatment center quick. Speed na the best chance for make that person they survive. Also, I will make you focus on this point here. When person don't contract or don't get this Ebola, dehydration na the main reason why people they die. So hospital go get for give and drip. Also, wash your hand with sanitizer. Bleach your bed sheets there, you cover close there when you debook. That's they kill the virus. Number 4 question I asked Dr. Thomson. The one day where they don't release after Ebola, how for treat there? Well, Dr. Thomson say, welcome them back now your community. Pass you they get sex with that person there. Now you for take time. You for take 2 months before you member safe for do anything sexually with that person. Number 5 question I ask her. Dr. Thomson, how far this virus don't spread? Well, he answer me say, first of all, 1976, 9FN Ebola in Zaire, na the origin land. Since then, Ebola don't spread go Uganda, DRC, Sudan. So this na the small outbreak there. We don't happen throughout time. But this na the first time it don't ever hit West Africa. Number 6, I ask Dr. Thomson. Give me 2 facts and 2 myths about Ebola. The one fact we say for sure, he say Ebola is a real threat to Salone, we neighbors, and overseas country them. Period. That's not the fact. The myth the way we don't hear them plenty, but one of them, if you cough in a room, you know mean say you go get Ebola, or the person within a room they go get her. Salt na lie. Nothing in order for do for help if you drink boku salt. Once again, na personal hygiene and fluid. Na the main thing. Now, my seventh question focus on this anti-Ebola, this serum where they don't develop called ZMapp. This was very interesting for talk to Dr. Thomson about this, and this now waiting he didn't get for say. ZMapp na an antibody treatment where they target the candida of the virus and they stop them from multiplying. But now only a few people then don't try and pass. The main focus once again is rehydration and supportive treatment. Now the best approach for Ebola. We still wait for your results then from doctors then globally about how sober ZMapp be. Finally, the main thing is whose time salon will return to normal. Well, you know, Dr. Thomson can only offer his own personal thoughts about this. So he said to me the main thing now for government for control the infection, then call it infection control practices. Once they don't contain this, all man get for make effort in the country. The virus can still then at the environment and can still come back after the containment period. So governments get forget sound contingency plan. Also, before they done, with mosquito there. The talk what on there plenty na mosquito then they spread Ebola. Dr. Thomson also advised say there's no evidence of this at all. The female mosquito na in the bed and I can take small blood from you. But so far, nothing no say they involve Ebola transfer. Thank you.